You're watching 12 WKRC TV, a new generation of news. 12 Newsmakers starts now.
Good morning and welcome to Newsmakers. Cincinnati, recognized in the 1940s and 50s as one of the best governed cities in the United States, saw its local government gradually spin out of control in the 1980s and 90s. The city administration went from being nationally recognized for its business-like efficiency to being characterized by perpetual indecision. The elected policy-setting wing, City Council, went from being a gathering of dignified leaders to an inexhaustible mine of source material for political cartoonists. But in the last 5 years, community groups engineered a series of structural changes holding out the hope of reestablishing leadership in this community. In 1999, voters strengthened the office of mayor while leaving in place the essential characteristics of the city manager form of government. That new structure went into place last December 1. And just last November, voters reformed the safety forces. That measure transformed the rules for future hiring and firing of police and fire chiefs, and at the same time, the position of safety director was eliminated so that the police and fire chiefs now report directly to the city manager, promising more coordination and efficiency. But the aftermath of the surprising, very public suspension of Assistant Police Chief Ron Twitty in a hastily called news conference gives anything but the impression of coordination.
There has been criticism in some quarters as to the way the city administration handled this matter. In this regard, I have already begun to review the policies and procedures followed, and I will be working with Chief Stryker and our new city solicitor to develop guidelines governing the initiation of independent investigations and review the use of press conferences to announce investigations of police officers.
What I was concerned about was that the city administration, council, mayor get on the same page in terms of where we were to reassure ourselves and the public that this matter was being handled expeditiously and with fairness.
To try to get a handle on the issues playing in the background of the Twitty affair, I am joined this morning by Eugene Beaupre. Eugene is a professor of political science at Xavier University and a longtime activist in city affairs and city politics and government. Gene, welcome back to Newsmakers.
Thank you. Nice to be here.
Just how disorganized are things?
Oh, Dan, that's a pretty loaded way to put it.
Well, I got to tell you, I think from the outside, it looks like people don't quite know.
Left hand, right hand thing?
Yep.
I think we have, and I would back up, I think your introduction was excellent. I would back up even farther and say, the city since April and the civil unrest has gone through a lot of changes. And what I'm teaching in classes, I talk about the fact that there are more voices being heard in many respects, I think, in the last couple years, last 2 years, last 18 months, than there has been in a long time. I mean, to me, that's a very positive thing. Let's remember, democracy is not exactly the most efficient system. Okay. So I think that's the background that's even more general than what you said. Now take what you said and let's say, here we have a bureaucracy, a huge operation, all the different services that the city provides, and we're changing the leadership on the elected side, on the administrative side. There are a number of city administrators beyond the city manager or below the city manager that are leaving soon as well. And those are changes that take time. Well, in the meantime, we've been tested repeatedly. I mean, not the obvious, most obvious ones, the Colonel Twitty one, which you mentioned, and the civil unrest and that sort of thing, but we've had to pass a budget. We're facing a city deficit. So I think before I'd say we're disorganized, I'd say we're straining under a new system that many people are still trying to figure out. And it isn't just the city manager and the mayor, the new council, many of them very young and very energetic, are looking for leadership roles. And I think that's still playing out.
Well, let's take a look at some of these individually. One of the things that is frequently said is, we went to a strong mayor, and I just keep beating the drum. We don't have a strong mayor. We don't have an executive mayor. We have a stronger mayor than we used to.
Yes.
Charlie is not an executive mayor, though. He does not run the city.
Doesn't.
And I think people have to be constantly reminded of that. How much, though, what are we learning about the limits of this stronger position? Because Charlie certainly knows government. He's not new.
Oh, absolutely.
He knows how to make things work.
Right.
Are we revealing that we maybe haven't gone far enough with giving him power?
Well, I think ultimately, and this isn't in the textbooks, but I think ultimately the way a system like this plays out and the way politics plays out has to do with personalities. And if it wasn't Charlie sitting in the mayor's chair, if it was some other mayor with a different personality, we may have a whole different set of experiences here. Charlie brings to that seat a particular way of operating. And when I first looked
How would you characterize his way of operating?
I would say he is a consensus builder. He tries to let things happen without his direct intervention in as many ways as possible. Now that's juxtaposed against some things that have happened in the city that have forced him into the front line, if you will, under the lights, if you will, in a way that probably no one, including himself, had anticipated. So having said that, though, when we first talked about this new system coming into place with the strong mayor, and I thought, here's a mayor who's going to assign committee chairs on council, a number of other, have the ability to veto, a number of things like that. I thought, this person is going to go in there and say to the chair of the finance committee, here's my agenda, and if you don't follow it, you're out the door. And, that Charlie has not been that way. He has given council, and I presume the city manager, a lot of room to move. And, frankly, I think that's very good.
Okay. Now you've made a value judgment. Now you think that's very good. Let me just flip that.
Okay.
Could some people legitimately say, though, we need a more aggressive agenda setter and leader out there? I mean, we hear this moaning about lack of leadership. Could Charlie use the office and the new powers he's got in a different way to exert more leadership?
Let me say two things about that. It's good, but it's risky, because he will still, as you say, be perceived as the leader. And so when things are happening, people are going to turn to Charlie and see what's going on there. So that's a risk. Again, I think democracy is a risk when you open it up to other people to make decisions. But secondly, I think Charlie has taken leadership positions in economic development and things like that, things that he is, and where they have been lacking in the past in many people's views, he has tried to take a leadership position. But take the issue not necessarily of Twitty, but of race relations. I mean, you can't look to a single individual like the mayor and say, solve this race relations problem. So how does he do that? He has to do it by some kind of consensus building or some kind of participatory process. He's not the only voice out there.
Cincinnati can?
Cincinnati can is one of them, but whoever can get that microphone in front of them is a voice that's going to be heard.
Let me ask, you've worked in City Hall, you've worked in council offices.
Twitch from it, no.
And you've worked in the administrative side. When a potential controversial issue comes up, and you never know where it's going to come from. So in this particular case, it was this thing with the highest ranking African American police officer. And the call comes over, in this case, from the police department to whoever, city manager's office to mayor's office, and says, we got a problem, here's what I'm thinking about doing. What happens? Is there a cabinet? Is there a group of advisors who get around a table and strategize about, hey, if we do A, this could happen. If we do B, this other outcome. Does that happen in City Hall? Do people interact with each other that way?
Well, let me say first that I think, given the experience that we've just had over the last couple of weeks with Twitty, it will happen in the future. I mean, I think that was the message in your clips that you showed, and that's, there were, I think, two really clear messages from the city manager. One is, that's one of the things we're going to do, what you just described. We're going to huddle. We're going to think this thing through a little better. Secondly, we're going to have procedures, and then maybe there's a third one, which wasn't in the clip, but I've heard elsewhere, which is the city manager was really responding to, at one point she said, something to the effect of community, we've heard the community's voice on this, or there's rising to, I mean, I thought that was a very interesting response. So I haven't heard city managers say that sort of thing. So on the now, you know as well as I do, in City Hall, the city manager's office and the mayor's office are just a foyer apart. And what, in the most effective system, I think, is when the city manager can walk across that foyer, sit down in the mayor's office, the mayor can bring in whomever he or she chooses, and they can have the sort of huddle, if you will, that you describe. I don't know whether that's happening now. It did used to happen in the past, that the city manager, whether it was Bill Donaldson or Cy Murray or one of the, would come over and say, I've got these issues. Now, this one was a particularly hot potato. But I've got these issues, and how do you think council will feel about them? How should we handle it publicly?
And can the mayor or the city manager then call down a council member to say, gee, we really need your input on this? Can we call up let me just, one of the things is, in the modern world, whether it's a corporation or a not-for-profit organization, they also have people who strategize about how to get your message out.
Exactly.
Communications people.
Right.
Does this organization have a communication strategy, a crisis communication strategy?
I can't answer whether this one does. You may know that.
Did it ever?
Yes, it did. I mean, there have been communication officers on the city manager's staff by various titles, sometimes ombudsman, whatever. When you talk about a nonprofit or you talk about a corporation, it is a fairly private operation. The city is a public operation, and if you're a reporter for this station and you want to talk to somebody about public policy, you're not going to talk to some communications officer. You're going to want to talk to the city manager. You're going to want to talk to the mayor.
Yeah, but that communications officer can help the city manager, the mayor, and other people figure out what's the best way to get a message out, and whether calling a press conference on a Friday afternoon is the best way to do that.
To develop strategy. Is there a strategy around all that? As I say, I think there will be in the future. I don't know whether there has been in the recent past, but as you've pointed out, so many changes have taken place. It's like building a house and then all of a sudden something happens, a fire breaks out, and you realize you don't have an exit plan. Well, you just hadn't gotten to that point yet, maybe.
Let's talk about one other component in this new configuration that used to get beat up all the time by people like me, but hasn't actually, and that's council.
Yeah.
How do you think council's adjusting to this new environment?
I would never have predicted the level of leadership that I've seen coming out of council based on this new system when it came into effect. I think there have been some, not just strong leaders, but leaders in the same. Politics to me is about building coalitions. It's one thing to get in front of the camera and preach your point of view. Right. It's another to get the 5 votes that you need to get something through council. That's one of the things this council has been extraordinarily good at. In addition to which, individually and in pairs and in other forms, they've taken initiatives, leadership things. I think the Crowley Pepper neighborhood initiative was a good example of that. So I think we've seen a lot of
reaching out to the schools.
Absolutely. We've seen a lot of leadership coming from council, and I think, frankly, and maybe someone would disagree with this, to the mayor's credit, there are mayors, as we know, who have personalities that would have stepped on that, and this mayor hasn't done that.
What about on the budget? You mentioned it early on. This is a tough area because of the reduction in funds.
Right. And again, the ability, and some of it was last minute agreements that were made, but they were able to reach in ways that I have, and you mentioned it in your opening, in ways that we haven't seen in years. So a lot of credit goes, again, I've got to argue, part of it's a system, but part of it is just the personalities that are involved.
So what we got is a new dynamic. We're still shaking that dynamic out and trying to figure out what works.
Right, and I don't think, right now I think you can't say this is the model because things are still evolving.
Thank you very much, Gene.
My pleasure.
This has been very helpful in terms of framework.
Good.
And we'll have you back.
Thanks.
Stay tuned. The West Nile virus is no longer an East Coast phenomenon. After the break, some advice about how to protect your family. Welcome back. West Nile virus first popped up on the nation's public health radar screen along the East Coast about 4 years ago. The first scientific evidence that it had spread to the Midwest was found last summer, with more evidence accumulating this summer. Last week, 12 News reporter Rich Jaffe prepared this report on the local spread of the disease and what people can do to protect themselves and their families.
West Nile virus has moved much more rapidly across the country than health officials ever expected. Spread by female mosquitoes, its only real threat is to people with weakened immune systems.
Most people do not get sick at all if they're bitten by an infected mosquito. Less than 1% develop any symptoms. This disease is not running rampant in our population. It's running rampant in the birds. So I don't feel that it's a serious disease threat for humans.
Birds who eat infected mosquitoes frequently die. Hamilton County health officials have seen so many dead birds, they've quit testing them.
There's no evidence out there that anyone has contracted West Nile virus from a dead bird. Just basic hygiene. Put on some gloves and pick it up and throw it away.
For homeowners, new trends in landscaping like ponds and water areas present perfect breeding grounds for mosquitoes. But there's a lot homeowners can do to minimize their exposure. With larger ponds, run the pump for at least half the day and clean smaller ones.
Just a small amount of water, like the indentations on top of this pot, are enough to breed almost any number of mosquitoes, and of course being right up underneath the deck. So if you're going to store pots, store them like this.
Stormwater runoff areas can also be a problem.
You might have a problem in your next door neighbor's backyard that you're not even aware of. So if you have a huge population, it's good to start expanding your searches out if you're taking care of everything at your home.
Health officials say be aware, but not afraid.
I don't think people should stop doing the things they do just because there's a threat, a very low threat, of them contracting West Nile virus.
West Nile virus has moved. To talk about West Nile virus and what we can do about it, I'm now joined by Chris Eddy, the Director of the Environmental Health for the Hamilton County Health District. Chris, welcome to Newsmakers.
Thank you, Dan.
I understand that you're also sort of a coordinator or leader of a team called SWARM, which sounds kind of interesting. What is SWARM and how does that relate to all of
Well,
this?
SWARM is an acronym for the Southwest Area Regional Mosquito Task Force. And it's actually a coming together, kind of a confederacy among local health jurisdictions to make sure that we're all preparing for and dealing with the possibility of the West Nile virus in the same way. In other words, the process of surveilling for mosquitoes, packaging them up, collecting them, sending them to the state lab at Columbus, and having them analyzed for this particular virus is a proceduralized process that really everybody needs to be doing it the same way. And we always like to say that mosquitoes don't respect the lines of jurisdiction. And when we have 14 contiguous health jurisdictions, we need to all be on the same page doing things the same way.
How far does that spread out when we put 14 of them together?
It actually goes as far north as Butler County, including the Middletown City Health Department, City Health District, and it goes all the way down to northern Kentucky. So we're actually going on north and south all the way to Kentucky and also Lawrenceburg, Dearborn County.
Okay. So really the metropolitan area, the
really,
tri-state metropolitan area.
The entire region.
What, and this was addressed to some extent, how serious is the problem in this region? I think Rich made the point that it got here a little faster than people might have expected. How serious is it at this point?
Well, it's serious, and that's why we're involved in the process of surveillance right now to make sure that we can kind of watch the progression of this virus into the region, but it's really not a surprise. And the risk is very low still. As recently as well last year, Richard Berry, the state entomologist, really predicted that things would pretty much unfold as they have this year. We expected the positive birds early in the summer. We expected some positive mosquito pools towards midsummer, and we would expect some horse casualties towards the end of summer.
Some horse casualties. Horses are going to die from this?
They are susceptible to the West Nile virus, and that, again, is not a big surprise. They're susceptible to eastern equine encephalitis, which we see in this region. The St. Louis encephalitis is also endemic in this part of the region.
And are those carried by mosquitoes?
They are, indeed.
Okay,
yes.
So mosquitoes are a significant problem, not just because of West Nile and not just because they're pests to humans, because they're aggravating, but they do carry serious other diseases.
Yes, and they really always have, and that's why we have had an ongoing surveillance program in place. Well, for at least the 8 years that I've been director of this division, we have been collecting mosquitoes, submitting them to Columbus at the State Ohio Department of Health's laboratory for analysis, just to keep track of those pathogens that we already knew about. And now West Nile is what we call an emerging pathogen. In other words, this is something that a pathogen we didn't expect to see here. When it showed up in New York, that was a big surprise because it actually came from the West Nile region in Africa originally.
I happened to be in New York City 2 summers ago, actually the weekend before they closed down Central Park for a few days, and I was in Central Park that Sunday because it was a beautiful day. On the news, they were spraying neighborhoods, aerial spraying of neighborhoods, high degree of concern. Is that the same level of concern that you have right now? Are we going to start seeing aerial spraying and that sort of thing?
Certainly not. We will definitely not see aerial spraying unless this thing went to epidemic proportions, and we just don't have any reason to believe that we're going to see that ever. Now, in the meantime, there may be a possibility that we need to expand our current pesticide application program. We are applying larvicide right now. When we get a call from a homeowner and they say, hey, I've got a body of water next door, or my neighbor has a swimming pool that they're not maintaining correctly and they're breeding mosquitoes by the thousands, then we'll send a sanitarian out there and apply larvicide and write orders to that homeowner to evacuate that pool, to dump it, and to maintain it correctly. And we actually have a new policy in place, and this is some of the more practical things that we do, that if that homeowner refuses to operate their pool as it was intended to be operated, in other words, the chemicals are balanced, mosquitoes aren't going to grow there, then we would actually order them to dismantle it and get rid of it. And that's important because they either need to operate it correctly or get rid of that pool. Now, applied a little bit more globally, there is a possibility that we'll see more mosquito pools down the road towards the end of at the end of the season, and that's when we're going to ask the homeowners to do their part and to help us eliminate this primarily residential problem. Because this particular species of mosquitoes, we're talking about the Culex mosquito, really likes man-made reservoirs of water. And we're talking about coffee cans, old tires laying in your backyard, toys hold water, just like you saw earlier in this newsreel.
Yeah, in the package, yeah.
A couple of ounces of water can breed mosquitoes. You know, I've seen little what I call tidal pools where pools swell up because of drain water, they recede again after the rain, and you have little pockets of water somewhere. I've seen mosquito larvae so dense you can pick them up with your fingertips.
So now wait a minute, I want to be clear. Is it that a new type of mosquito has come into our area, or the mosquitoes we've known for a long time are now carrying a new pathogen, as you call it?
I think it's really the same old mosquito.
Okay.
And they're carrying a pathogen that we're not used to.
Okay.
And part of the reason that we're finding it now is because we're looking very hard, and we're being very diligent.
Now you're saying that we won't see aerial spraying as they did in New York. Are they continuing to do aerial spraying in New York? Is it that they just have a more serious problem and we don't have that kind of serious problem, or that they misjudged how serious this was to humans?
Well, I hate to second guess some of the decisions that were made up in New York City, and I think that they did a commendable job of dealing with a crisis that kind of just showed itself one day out of nowhere.
Okay, but let's not criticize them, but how do we evaluate what's here?
Yeah, well, I think that we need to look at our indicators. We're following closely the directives by the Ohio Department of Health, which is coordinated and taken directly from the Centers for Disease Control experts down in Atlanta, Georgia. And we have indicators. At certain points, we have a trigger, which would indicate that we need to escalate our surveillance activity. And at certain points, we would consider the possibility of adulticiding. And again, to make very clear the distinction between larviciding and adulticiding, larviciding, we're using a very benign bacterial agent, which is a naturally occurring agent. It's not harmful to humans or pets. It's specific to mosquito larvae and blackfly larvae. And we can apply this to a body of water. It has a residual for about 30 days, and we can knock out the larva before it becomes adult.
Do professionals, do you have to apply that, or can homeowners get that and apply
That's
that?
a great question. I'm glad you asked. Actually, homeowners can get this material, and it's basically called a mosquito dunk. That's a generic term we'd use for it. It's a Bacillus thuringiensis, or called BTI for short. That's the acronym. You can go to just about any nursery and many hardware stores and acquire this material. And this is something that's really been carried recently on that kind of demand.
Is it dangerous for the individual person to handle it?
Not at all. And you follow the label's instructions, and you want to wash your hands after you use it. But you can actually use your bare hands, and we do regularly.
Okay.
And really, that's the distinction. We would really like the homeowners to acquire this material. Now,
Okay, so homeowners should get rid of those little pools of water.
That's right.
But they should also, was not in the package, can get this material, and the name of it again is?
You can call it a mosquito dunk.
Okay.
And it's also called BTI, and that stands for Bacillus thuringiensis. And it's a bacteria, and it's a very benign bacteria.
And the third thing is, if you have a neighbor with a problem, like a pool that's not being maintained, they can call you, right?
They can call us, and we'll send our people out there.
And what's the telephone number?
That is 946-7832.
946-7832. We also have a website that I want to show real quickly, www.hamiltoncounty county with a /.org/BOH. Chris, thank you for being here this morning, and we'll see how this develops over the next couple of months and maybe next summer, too.
It's been my pleasure.
Thank you. Thank you for making Newsmakers a part of your Sunday morning. Join us again next week to meet the women and the men shaping our community for the future. Have a good week. Chris.
There. I've had too much cowboy habit. Good. We're going to see the benefit of Peter and Chris's work for the morning. This is the unveiling. And see if there's anything left. Well, I got to get down there a little bit now, Peter. You rolled the...
And it's actually a coming together, kind of a confederacy among local health jurisdictions to make sure that we're all preparing for and dealing with the possibility of the West Nile virus in the same way. In other words, the process of surveilling for mosquitoes, packaging them up, collecting them, sending them to the state lab at Columbus, and having them analyzed for this particular virus is a proceduralized process that really everybody needs to be doing it the same way. And we always like to say that mosquitoes don't respect the lines of jurisdiction, and when we have 14 contiguous health jurisdictions, we need to all be on the same page doing things the same way.
How far does that spread out when we put 14 of them together?
It actually goes as far north as Butler County, including the Middletown City Health Department, City Health District, and it goes all the way down to northern Kentucky. So we're actually going on north and south all the way to Kentucky, and also Lawrenceburg, Dearborn County.
Okay. So really the metropolitan area, the
really
tri-state metropolitan area.
The entire region.
What, and this was addressed to some extent, how serious is the problem in this region? I think Rich made the point that it got here a little faster than people might have expected. How serious is it at this point?
Well, it's serious, and that's why we're involved in the process of surveillance right now to make sure that we can kind of watch the progression of this virus into the region, but it's really not a surprise. And the risk is very low still. As recently as, well, last year, Richard Berry, the state entomologist, really predicted that things would pretty much unfold as they have this year. We expected the positive birds early in the summer. We expected some positive mosquito pools towards midsummer, and we would expect some horse casualties towards the end of summer.
Some horse casualties. Horses are going to die from this?
They are susceptible to the West Nile virus, and that, again, is not a big surprise. They're susceptible to eastern equine encephalitis, which we see in this region. The St. Louis encephalitis is also endemic in this part of the region.
And are those carried by mosquitoes?
They are, indeed.
Okay,
yes.
So mosquitoes are a significant problem, not just because of West Nile, and not just because they're pests, to humans, because they're aggravating, but they do carry serious other diseases.
Yes, and they really always have, and that's why we have had an ongoing surveillance program in place. Well, for at least the 8 years that I've been director of this division, we have been collecting mosquitoes, submitting them to Columbus at the State Ohio Department of Health's laboratory for analysis, just to keep track of those pathogens that we already knew about. And now West Nile is what we call an emerging pathogen. In other words, this is something that a pathogen we didn't expect to see here. When it showed up in New York, that was a big surprise because it actually came from the West Nile region in Africa originally.
I happened to be in New York City 2 summers ago, actually the weekend before they closed down Central Park for a few days, and I was in Central Park that Sunday because it was a beautiful day. On the news, they were spraying neighborhoods aerial spraying of neighborhoods, high degree of concern. Is that the same level of concern that you have right now? Are we going to start seeing aerial spraying and that sort of thing?
Certainly not. We will definitely not see aerial spraying.